On June 9, 2011, Richard James Rohn walked into an RBC bank in North Carolina and robbed them for $1. After handing the teller a note stating he had a gun, which he did not, and demanding $1, he said, "I'll be sitting right over here on the chair, waiting for the police." Like nearly 50 million Americans, Rohn has no medical insurance. Suffering from a variety of ailments, the 59-year-old man viewed a prison sentence as his best chance of getting the medical care he needed. Although 21st century medicine is widely available to most, many Americans are unable to get basic 19th century care. While many have proposed ways to fix the system, the debate has centered on the way method services are provided, specifically on the means of funding medical services. America's healthcare problems may have started years ago, but there is no shortage of views on this national debate about our simplest needs.
The modernization of healthcare began in 1847 with the establishment of the American Medical Association, which set out to promote the art and science of medicine and the betterment of public health. As Americans industrialized, changes in how medical services were rendered occurred too. With the mission to create a minimum standard of life below which no human can fall, reformers created the American Association for Labor Legislation in 1905 to push forward the idea of social insurance. Physicians opposed it because they felt that they were not being paid enough for what they were doing. The reformers' fight came to a halt in 1914 due to World War I. Following the war, reformers began to fight for health care because employees were taking off work to see a doctor, but not being paid for the time off. Reformers saw how much more the doctors were charging due to advances in treatments such as operations and medications. Although the Great Depression prompted the passage of the Social Security Act, it omitted health insurance, which led to the establishment of the Blue Cross. During World War II, companies had to compete for employees. One way they did this was by offering health care benefits to employees' wages, which gave them the way to the employer-based system we have today. Healthcare reform came to a pause in 1950. People who were unable to afford private insurance bought it, and those who could not had to turn to welfare services. Since the government was responsible for the poor and their health care, legislators proposed health insurance, but none of the bills passed. In the following decade, healthcare costs doubled, making it even harder for the elderly and the poor to receive reasonable services. President Lyndon Johnson passed an act in which Medicare and Medicaid were added. However, by the late 1960s, healthcare costs were at an all-time high due to inflation. Medicare, new technology, medications, and treatments were available. President Nixon tried to fix this by implementing national health insurance, but it was quickly rejected by liberals and labor unions. Privatization of health care began to increase, with organizations offering benefits to their employees to cut costs and consolidate control. President Reagan made the changes to Medicare by modifying it to pay when diagnosed rather than when treated. In 1994, President Clinton tried but was unsuccessful at passing universal health care. While healthcare costs have always been rising, the dramatic rise in new treatments and technologies has resulted in an exponential rise in healthcare costs. 3% of U.S. federal spending in 1960 and 20% in 2010.
Universal healthcare has many proponents, from journalists to medical professionals. One of the most recognizable proponents of universal healthcare is filmmaker Michael Moore, best known for his documentary film Sicko. In the film, Moore criticizes the healthcare industry in the United States, particularly the dominant role of insurance companies. He contends that a doctor has to ask for permission from HMOs before he or she can treat a patient. Unfortunately, most of the time, the insurance companies do not cover all the healthcare costs for all the insured customers because of the fear of not making money. Thus, everything medical professionals do for their patients, assessments, diagnostics, therapy, has to be authorized by the insurance company. Moore exposes the injustices of the system by interviewing people who cannot afford its services and comparing the United States to countries such as France, England, Canada, and Cuba, where the government has taken over the healthcare system. Moore argues that the government should control our healthcare system. He wants the government to take over and accomplish 4 things: support free, universal care, eliminate private insurers, regulate pharmaceutical companies, and refuse money from the healthcare industry. On March 23, 2010, President Barack Obama put Moore's ideas into law, at least partly, by signing the Affordable Health Care Act. Obama stated that this legislation makes healthcare more affordable, sets up a new competitive health insurance market, makes health insurers more accountable, ends discrimination against Americans with pre-existing conditions, and puts the American budget and economy on a more stable path. Despite moving toward the basic principles of universal health care, Ohio Congressman Dennis Kucinich, who regards health care as a civil right, called the legislation seriously flawed because it does not create a single-payer system and gives authority to the insurance companies. He has been advocating the single-payer system for years because he believes that it is the only real solution to the failures of America's predatory healthcare system. Kucinich believes that insurance companies are making money by denying healthcare services of the insurers. Although he initially voted against the healthcare bill because it lacked a single-payer system, Kucinich ultimately switched his vote to a yes, conceding that something is better than nothing. Like Kucinich, Senator Bernie Sanders of Vermont believes that healthcare is a right, not a privilege. Just as other industrialized countries regard healthcare and how the United States regulates water, education, electricity, protection, etc., he believes that all Americans should be entitled to healthcare and that nobody should be discriminated from the system. In the Huffington Post, Sanders notes that more than 18,000 Americans die each year of preventable diseases, simply because they do not receive any medical attention. Therefore, he thinks that there is sufficient evidence that we must consider ending the dominance of HMOs in the American healthcare system and establish a publicly funded, single-payer healthcare system for all. Economist Holland Jorgensen also supports the public option. Just like Moore, she points to the 46 million Americans who are denied healthcare as the system's greatest failure. In Sick and Tired, How America's Healthcare System Fails Its Patients, Jorgensen proposes the public option, which she argues will provide affordable health coverage for people who cannot afford high premiums. She recommends allowing patients to have long-standing coverage so their diseases can further be monitored, prevented, and treated. Holding to the proverb, an ounce of prevention is worth a pound of cure, Jorgensen concludes that universal health care is a good investment because it will prevent disease and save money. Rafi White, a member of the Physicians for a National Health Program and a businessman who established a profit-oriented private practice with several other doctors, also supports universal health care. After his profit-oriented practice went bankrupt, he conducted a study of the healthcare system. White concluded that the healthcare system is broken, and the only solution is a single-payer program, wherein the government pays for the medical insurance of all Americans.
Despite its humanitarian motives, there are many who oppose universal health care in favor of maintaining privatization. One of the most visible advocates of privatizing the American healthcare system is journalist John Stossel, who argues that healthcare should remain privatized and profitable for the advancement of medicine. In his article in the online magazine Reason, he admits that American profit-driven, partly bureaucratic system is expensive and sometimes wasteful, but he argues that it is the pursuit of profit. That minimizes waste and costs and ultimately paves the way for medical innovations to take place. In other words, privatization of healthcare systems, according to Stossel, is beneficial because profit is an incentive that drives medical breakthroughs and improves the quality of treatment. Furthermore, the government is inefficient at controlling costs, and while advocates of national health care argue that the single-payer system will lower costs, Stossel points out that history tells us the opposite is true. Likewise, David Kratzer, a Canadian doctor, argues that capitalism can save the American healthcare. He believes the United States has been made remarkable progress in medicine, resulting in best healthcare in the world. He cites the number of innovations that have resulted from privatized healthcare that many Americans virtually take them for granted. According to Paul, the quality will deteriorate because of delays in authorization from bureaucratic red tape, and doctors will spend more time preparing government paperwork, which resulted in increased costs. Furthermore, removing the incentive for medical practitioners to provide a competitive service will also lead to unnecessary waste and inevitable rationing. Alan Miller, CEO and founder of Universal Health Services Incorporation, argues that Americans should say no to the public option because this misguided philosophy will lead to shabby, undercapitalized, bureaucracy-mired healthcare systems with hospitals that lack the latest equipment. According to Miller, capitalism is not the problem, but the solution. He points out that the private sector actually does the government a favor when it invests heavily in technology and facilities, because it pays taxes and provides services similar to nonprofit organizations. Miller's greatest criticism is for the government, whose incapacity to emulate the experience of private sector who have been in the healthcare industry for over 100 years. Therefore, a government-run healthcare system will deteriorate the quality of healthcare in America. Lastly, the Cato Institute also promotes the private option. In Healthy Competition, Michael Cannon and Michael Tanner of the Cato Institute argue that U.S. has the finest healthcare system in the world because it possesses the best doctors, hospitals, and research facilities in the country. The United States has made significant progress in the fields of pharmacology and medical technology in the recent years because of the competitive nature of their healthcare systems.
In Understanding Health Policy, Bodenheimer and Grumbach state that all healthcare systems face the same challenges: improving health, controlling costs, prioritizing allocation of resources, enhancing the quality of care, and distributing services fairly. Regardless whether the healthcare system is mandated by government or by private sector, it is a glaring fact that all Americans have the right to have their healthcare needs be met. Therefore, healthcare must be delivered. A compromise has to be agreed upon as soon as possible to provide these needs, because for every delay in the delivery of healthcare, there will be either an increase in the morbidity on the lighter side or an increase in the mortality of the Americans at the worse side.